Hi, I'm Dr. Randy Martin for CardioSource Video News. Now, recently, the FDA just released new warnings on the use of gadolinium-based contrast agents. And here to discuss that with us is Dr. Christopher Kramer. Chris is actually the associate editor of JACC Imaging. Chris, thanks for being with us.
Thanks for having me.
I said these are new. Is this really new? Or?
Well, it's not necessarily a new warning. What they've done is a recommended labeling of all gadolinium-based contrast agents in regards to the risk of nephrogenic systemic fibrosis in patients with stage 4 to 5 chronic kidney disease who receive these agents.
And so, I mean, but it seems to me when I first heard about this, I thought we already knew about this. Is this what's the FDA warning really mean?
Well, it's really just a change in requiring the labeling of the drugs. They originally came out with a warning in December of 2006, was the initial warning, in which it was recently recognized the association between nephrogenic systemic fibrosis, which is a rare sclerosing disease, and associated with gadolinium in patients with severe chronic renal disease. And it was found that in some patients with this disease that they had gadolinium in skin biopsies. And it was then recognized, the association. So in 2006, the FDA came out with a warning, and beginning from that time point onward, those of us who use gadolinium began to avoid the use in patients with a creatinine clearance less than 30, and also used the lowest dose possible, etc.
Is this, excuse me for interrupting you, is this all gadolinium-based agents or just certain ones?
Well, certainly the FDA has recommended the labeling of every agent that is made with gadolinium containing, even the more recent agents which may have do a better job at chelating the gadolinium. What happens in renal failure is that the gadolinium circulates, it becomes unchelated, and it's unchelated gadolinium that is toxic to tissues. And that's why it's really a danger in patients with renal failure. You or I, we excrete it right away. And so the older gadolinium-containing agents are not as tightly chelated, and they may be at higher risk, but the FDA has said that any gadolinium-containing agent requires the warning. It's certainly the older agents that have more of the cases associated with them. That may be because they've been around longer and used a lot more, but also it may be because they chelate gadolinium a little less tightly.
So I'm familiar with chronic kidney disease, chronic kidney failure, as we'll say. What about acute kidney problems?
They certainly recommend avoiding the use in patients with acute renal injury, hepatorenal syndrome, and because they too may be at risk. It turns out, though, there are no reported cases in patients with creatinine clearances of greater than 30, and the incidence of this disease has become almost negligible with a change in practice beginning in late 2006.
So for our colleagues that are watching, if they want to get a gadolinium study, what do they need to know?
They need to know the patient's creatinine clearance before they decide to administer gadolinium, and if the creatinine clearance is over 30, even then to use the lowest possible dose and avoid multiple doses. It's clear that it's a cumulative dose that raises the risk.
What about one final question? What in somebody who has a filtration rate of less than 30, but you really need the information, is it okay to use them in those patients?
You can use them with the caveat that you need to dialyze the patient probably once a day for the next 2 or 3 days, and 3 successive dialysis therapies can remove 97% of the gadolinium.
Well, that's super, Chris. Thanks very much for clarifying this for us. Thanks for joining us.
Thanks for having me.